As the global population continues to age, diabetes is becoming increasingly prevalent among older adults. One of the most serious and often overlooked consequences of this chronic condition is the development of diabetic foot complications. These issues can begin subtly, but may progress to severe outcomes such as chronic wounds, infections, or even amputation if left unaddressed. This video highlights 4 major diabetic foot complications: peripheral neuropathy, impaired wound healing, foot ulcers, and Charcot foot, emphasizing the critical need for awareness and early intervention in the elderly. Peripheral neuropathy, the starting point. Peripheral neuropathy is often the earliest and most insidious diabetic foot complication, especially in elderly individuals. This condition stems from prolonged high blood sugar levels damaging the nerves, particularly in the feet and hands. In older adults, neuropathy typically presents as numbness, tingling, burning, or sharp pain, along with a diminished ability to feel temperature changes, pressure, or injuries. Because these symptoms can develop gradually, many elderly patients remain unaware of the extent of their sensory loss. This lack of sensation significantly increases the risk of unnoticed injuries, from stepping on sharp objects to developing blisters from poorly fitting shoes. Without pain to alert them, patients may continue normal activities, unknowingly aggravating the damage. Over time, these untreated microtraumas can lead to more serious complications like infections or ulcers. Compounding the risk is that older adults may have limited mobility or vision, making self-examination more difficult. As such, peripheral neuropathy sets the stage for a cascade of diabetic foot issues. Recognizing the early signs and performing routine foot assessments are essential steps in preventing further harm. Delayed wound healing, a growing concern. Poor wound healing is a major concern in elderly individuals with diabetes due to the body's impaired regenerative capabilities combined with age-related physiological decline. Diabetes interferes with several critical aspects of the healing process, including reduced circulation from peripheral artery disease, a compromised immune response, and decreased production of collagen and new skin cells. These factors mean that even a small cut or blister may persist far longer than normal, potentially becoming infected or turning into a chronic wound. In older adults, this risk is significantly heightened as circulation and immune function naturally decline with age, further slowing recovery. Additionally, many elderly patients may not regularly inspect their feet or recognize the early signs of infection, such as redness, swelling, or warmth. This delay in recognition can allow minor injuries to evolve into more serious medical problems, including cellulitis or ulceration. Inadequate wound healing not only poses direct health risks but also contributes to decreased mobility and increased dependence, eroding overall quality of life. Addressing this complication requires vigilant monitoring, proper wound care practices, and close collaboration between patients, caregivers, and healthcare providers to catch and treat injuries before they escalate into critical conditions. Foot ulcers, a major risk factor for infection. Diabetic foot ulcers are among the most dangerous and prevalent complications in elderly individuals with diabetes, serving as a major gateway to infection and even amputation. These ulcers typically occur on the sole or near pressure points of the foot and result from a combination of factors, including peripheral neuropathy, poor footwear, and repetitive trauma. Because many older adults with diabetes have reduced sensation in their feet, they may not notice small injuries or pressure points that eventually break the skin. Over time, constant pressure and friction can create open wounds that fail to heal properly. If not promptly treated, foot ulcers can become infected, leading to cellulitis, abscesses, bone infections, osteomyelitis, and gangrene. The risk of hospitalization and surgical intervention increases sharply in the elderly, especially when ulcers are ignored or mismanaged. In many cases, amputation becomes the only viable solution once infection spreads or tissue death occurs. Prevention hinges on daily foot inspection, protective footwear, and immediate care for any skin damage. Given the potentially devastating outcomes, foot ulcers require aggressive medical attention and regular follow-up. Charcot foot, the silent structural breakdown. Charcot foot is a severe, often under-recognized complication of diabetic neuropathy, posing a significant risk to elderly individuals with diabetes. It involves the gradual weakening and destruction of bones, joints, and soft tissues in the foot and ankle, frequently triggered by minor trauma to an insensate foot. Because peripheral neuropathy diminishes pain perception, patients may continue to walk on a damaged foot, worsening the condition without realizing it. Early symptoms include swelling, redness, warmth, and a sense of instability, but without proper evaluation, these signs are often mistaken for simple inflammation or infection. As the bones deteriorate and joints collapse, the foot can develop serious deformities, such as the characteristic rocker bottom shape. These changes compromise the structural integrity of the foot and significantly increase the risk of ulcers and infections due to abnormal pressure points. If left untreated, Charcot foot can lead to permanent disability, repeated hospitalizations, and, in extreme cases, amputation. The role of prevention and early detection. Preventing diabetic foot complications in the elderly requires a proactive, comprehensive approach centered on early detection, education, and consistent care. Daily foot inspections are one of the simplest yet most effective strategies. Patients or caregivers should check for redness, swelling, cuts, blisters, temperature differences, or changes in skin color. Proper footwear that provides support and minimizes friction is equally important, especially for those with neuropathy. Regular visits to a podiatrist can identify early signs of complications before they escalate, allowing for timely interventions such as orthotic adjustments, debridement, or protective dressings. Glycemic control remains a cornerstone of prevention, as uncontrolled blood sugar exacerbates nerve damage and impairs healing. Even small foot injuries should never be ignored. Prompt medical evaluation and treatment can prevent progression to ulcers or infections. In conclusion, diabetic foot complications represent a significant threat to the health, mobility, and independence of older adults. Beginning with subtle signs like peripheral neuropathy and potentially advancing to severe issues such as foot ulcers or Charcot foot, these conditions demand continuous attention, informed care, and early intervention. Without proper management, they can lead to serious outcomes including infection, hospitalization, and even amputation. However, with consistent monitoring, patient education, and timely medical treatment, many of these complications are preventable. By prioritizing foot health as a critical part of diabetes care, we can help elderly individuals maintain their mobility, reduce the risk of serious complications, and preserve their overall quality of life as they age.